Welcome back to Normalized PTSD. Today we have prolonged exposure therapy with Dr. Mclean. This is an evidence-based therapy that's one of, I guess, the most common ones that I've experienced with the VA. It's just a little bit more in-depth dive into what it is, some of the ideas behind it, and I hope you find it informative. All right.
Today we're met with Dr. Mclean. Mclean, you're a specialist in PE, also known as prolonged exposure therapy. I was hoping you could just give us a brief, summary of who you are, what you do, and then after that, jump into it.
Okay, let's do it. So I'm Carmen Mclean. I'm a clinical psychologist, and I work at the National Center for PTSD, which is like a specialty research center at the VA. And my work focuses on exposure therapy for PTSD. That's what my research is on. And I'm also trained in the delivery of prolonged exposure for PTSD and have used that clinically to work with PTSD patients.
Okay. If you want to dive into what is prolonged exposure?
Yeah, so prolonged exposure, or PE for short, is a type of cognitive behavioral therapy. So cognitive behavioral therapy, or CBT, is like the umbrella term. PE is a type of cognitive behavioral therapy, which just means it sort of focuses on behaviors or styles of thinking that are not helpful for people, and it works to shift those things, usually in like a short-term therapy format. But PE specifically, it is a trauma-focused treatment that involves exposure to trauma-related memories and trauma-related situations to help people learn to kind of learn that situations are safe, learn that they can think about things, help them process the memory so that they can move forward and get back to living like a fuller life again.
So they're able to be in those emotions, which are traumatic for them, but in a safe environment. And then I guess through that process, learn to, I guess if they're triggered, to walk it back and be like, hey, I'm safe, I'm comfortable, along those lines.
Yeah, so what we think kind of maintains PTSD and keeps the symptoms going is avoidance. That's like a really big factor with PTSD, is avoidance. And people with PTSD avoid in a couple different ways. So one is that they avoid thinking about the trauma that they've experienced. So it pops into their mind, they shove it down, they distract themselves, they keep themselves busy, they push it away as best they can, which makes so much sense, right? Because it's painful and we all want to move away from pain. So it's very understandable to want to do that.
Right.
Unfortunately, it tends not to work. It doesn't tend to kind of keep it away, right? It in fact actually can sometimes bring it up even more. Like the more effort you put into like thinking about something, the more it pops back up into your mind. But often people are putting in a lot of effort into trying to avoid those thoughts and the memories related to trauma. And then the other way that people with PTSD avoid is by, not doing certain things, not going certain places, trying to avoid things in their daily life that are triggering for them, that remind them of the trauma or that just feel less safe since the trauma. And right. The problem with that strategy, of course, is that, it's one, it's sort of hard to avoid everything. And two, I guess what success in that scenario looks like is you end up living a pretty small life, right? Where there's a lot of situations you can't do. And that can butt up against people's, values of like, it's important to me, for example, that I can go to my kid's baseball game, but I feel uncomfortable in that crowded situation, so I can't go. So that's problematic as well. So we think avoidance is really important and what kind of keeps the PTSD symptoms going. And so prolonged exposure therapy is a treatment that helps people to do the opposite of avoid. It helps them approach. And that can definitely seem kind of, maybe it's sort of scary for folks. because, as I said, it's really understandable to want to avoid thinking about the trauma and avoid situations that make you really feel distressed. But those strategies just don't work like in the long term. They might help you feel better in the short term, but in the long term, they really keep people stuck. And so in my experience, people often, when you kind of explain this, people often really get the basic idea of like, I can't avoid this forever. Like, this isn't working for me. I need to try something different. And this treatment is a really good way of systematically helping people to approach so that they can actually process it and move forward.
Right. And from my personal experience, I believe, like my tolerance for being uncomfortable. I'm a veteran with PTSD also, so I used to avoid a lot of things, and my threshold for being uncomfortable seemed to get like more sensitive. So the more I avoided things, the more things I felt like I had to avoid because the more I wasn't comfortable being uncomfortable. So on that, we'll just for someone with PTSD who's going to start PE, what are they getting exposed to?
Yes. So, well, you'll notice I like to use the word approach instead of expose, because it just feels more like what it really is, which is like, you do have a choice in this and it's collaborative. Like, it's not like something scary is like being forced on you. But yeah, if you're interested in doing PE, what you can expect is a therapist to work with you to understand a little bit about your trauma and the things that you avoid, and then to work with you to kind of come up with a plan for how you're going to break that cycle of avoidance and systematically and gradually start approaching situations. So in PE, there's sort of two different ways people can avoid. So one is like the thoughts and feelings and the memories, and then the other is actual situations in their daily life. In PE, there's two ways that we help people approach. So one is we help people approach the memory of the trauma. And so that's done in the therapy session with your therapist. They would help you kind of revisit the memory of the trauma and actually go through the whole thing and talk about it, and kind of recount the memory of the trauma. And you do that for like a prolonged period. That's where the name of the therapy came from, that prolonged exposure, is you're really sitting with the with the trauma memory for a while. And the reason that that's so important is because, what happens if you have let's say the memory of the trauma pops up into your mind, it causes a lot of distress. There's often a lot of like intense emotions that are linked up with that memory, right? So you feel a lot of distress. What do we want to do? We want to move away from it. So you push it away, and the downside of that is it doesn't help people actually see that they can stay with the memory, and that if you do stay with it repeatedly, something kind of magic happens, which is extinction learning, which is that you learn you can actually tolerate it. And physiologically, we cannot. People think, oh, maybe I'll just feel distressed kind of forever, or it'll just go up and up and up until I don't know what will happen, but I can't tolerate it. And that isn't what happens. And doing this sort of prolonged sort of sitting with and recounting the trauma memory gives people a chance to see that their distress typically does come down when they stick with it, either sort of within that same session, or when they go to talk about the trauma again the next session, they'll find that it's a tiny bit easier. Maybe not much, maybe just a tiny bit. But again, with repetition, it really does tend to be the case that people will say, you know what, this memory is still horrifying. It's still awful, this thing that happened to me. But it feels like a memory to me now. It doesn't have that same hold on me that it used to. It doesn't feel like I'm back there when I think about it now. So there is really something really kind of magic that happens when you, systematically with a therapist's, support and guidance, go through this process of staying with the memory and recounting it for a prolonged period. So that's one type of kind of approaching that's done in PE, and that procedure is called imaginal exposure, because you're kind of approaching the trauma memory in your imagination.
Right.
The other thing that's done is called in vivo exposure, and that is helping people to approach the situations in their daily life that they would like to be comfortable doing, but that they aren't because of the trauma. And that's going to depend like what a particular individual's trauma was, like what are the situations, like maybe it's crowds, crowded places, public transportation. Maybe it's like, little things like certain smells or being around certain people, or, it could be, it could really be anything depending on what the trauma was. But usually you kind of come up with a list of what those situations are, and then you start with the ones that are going to be easier, so that you are, so that it feels manageable, and then you're kind of building on your success as you get more comfortable, and you have that, and you really see like, actually, this does work. Like I can stick with it. My distress does come down. I'm ready to take on this next one, and you kind of work up that list systematically. That's one of the things you do kind of outside of the session time. It's sort of like a therapy homework exercise that's done.
Right. And just for an example, for those that are listening, I did the IVET program with the VA, and some of mine were like sitting in the room, like the center of a restaurant, instead of like picking the corner booth and facing like, it's where I could see everything. It was like, you're going to go to the very center and you're going to be okay with it. And another big one for me is the grocery store. I don't know why, because I guess because it's crowded, but it definitely being, I guess, introspective in that moment and being able to identify my emotions and the levels of my emotions going in, and then cruising until those emotions were half that. That was an interesting exercise, seeing that it can de-escalate. And something I used to track that was the PE coach, which is, if you want to elaborate a little bit on the PE coach, it's a mobile app that we used.
Yeah, PE Coach is one of the mobile apps that our center has actually developed. There's a mobile apps team that's part of our center here at the VA. And it's a treatment companion app, which means like some apps that are like, just here's a self-management tool. You can kind of use this app and see if it's helpful to, on your own. Whereas PE Coach, and there's some other ones too, are really designed to be used when you're in therapy with a provider.
Right.
So it's not a standalone, treatment. But if you are doing PE, it's a nice app to use. It basically kind of automates a lot of the stuff that you would otherwise have to do with like paper and pencil, forms and things like that. So there's a lot of things that you are tracking when you do PE, like you're practicing of different therapy skills, or you're just like your distress level, as you mentioned, when you're doing an approach exercise. So it's a really handy way of like tracking all of that stuff. And then you can also like record things that you need to record in the session, and you have that on your phone to listen to. So it's it does really kind of facilitate things. It's I think a really useful tool.
So approaching imaginary thoughts, like the process of looking back on, I guess, trauma, that can be really intimidating to some people. What words of encouragement, or what could you say that would maybe put them at ease on that approach?
Yes, I do. I get it. I get that people be like, I am trying everything I can to not think about this. Like, what are you talking about?
Right.
Why on earth would I want to purposely think about it and think about it a lot and think about it for a prolonged period? Like, that's the opposite of what I want to do.
like maybe they're fearful of it becoming worse, because I know
It's fearful of, yeah, totally. Go ahead. Yeah.
That was one of my fears coming into it. I was like, I feel like I've processed, like I've been like getting better with PTSD stuff for years now, just trying new things. But one of my fears was like, well, I feel like I'm in a pretty solid place right now. If I go and dive deep to like fully process this, I don't want to be worse,
Yes. Yeah. Yeah. I hear that. I hear that a lot. Um, I think you have to decide if what you're doing is working for you or not.
Right.
Which I kind of alluded to before. Like if you feel like you're really in a good place, that's great. If you feel like I'm sort of in a good place,
Right.
but if I'm being honest with myself, I'm actually maybe not in such a great place. And actually it's also taking me like huge amounts of effort and mental energy and everything to kind of maintain what I'm doing. Then you might want to like think about starting a treatment like PE. But yes, so approaching the memory of the trauma it can be sort of daunting idea for folks. I think it really helps to understand like the rationale for it, right? Which I mentioned before of like trying to avoid thinking about it and staying like distracting yourself and all of that. It's typically not a great long-term solution. So if somebody has like come in to like seek treatment for PTSD, they would probably, realize, like acknowledge that, right? Like what they've been doing hasn't been working super well. Right. Otherwise they wouldn't be there.
Exactly.
And so the other thing I would say is like, when people if you have PTSD and you have like, nightmares or like intrusive memories, something triggers you and the memory comes up and it's really distressing for you, that's a little different than systematically approaching the memory of the trauma. So an analogy I like to use is it's like the difference between, you're somebody saying, okay, I have this baseball and I'm going to pass you the baseball and get ready. Here we go. I'm going to pass it to you. 1, 2, 3, and then throws you the ball and you catch it. It's the difference between that and somebody just like chucking a baseball at you when you aren't paying attention. And like, it's sort of the same thing. Like you're getting the ball, but it feels very different. I think when you do it in context of therapy with your provider who's guiding you, who's supporting you, and it's done very sort of systematically.
Right.
I also would say, like, I think there's part of it that's like, it's a little bit of it's a little bit of like a leap of faith, of like, you have to sort of trust, I think, what your therapist is saying, that even though this is really uncomfortable in the short term, it's going to be a good thing to do in the long term, right, in terms of reducing your symptoms overall. And, you can talk about it intellectually as much as you want, but I don't think there's a way of getting around there's like a little bit of like, okay, I'm just going to give it a go and trust this process and see what happens. And then when you experience it for yourself and you have that experience of, wow, I actually could tolerate that. I got through the whole thing. And maybe it sucked a lot that first time, but I got through it. And next time it was like a little bit easier. And I can kind of start to see like a light at the end of the tunnel here for how this is going to go for me.
Right. And my experience is we didn't jump into the deep end of the pool right off the bat. It was kind of a gradual process, and it's all based off your comfort level, but there was a bit of tough love in there too. It's like, you want to do this again? And I was like, no. She's like, well, we're going to. And I was like, all right, let's do it. This is a question that just kind of popped into my head. So if you're not prepared or not comfortable answering it, that's fine. But I was just thinking, it seems like being honest with oneself is a big part with all treatment. First identifying that you need treatment. Like, what are some tips that you would give someone to be objective with their own situation and their own self? Because, like, for example, I have friends that are, swear that they're absolutely fine, and I'm like, okay, and you could see their life, and like being someone who's like on the, I guess, the recovery end of PTSD, you could see a lot of the stuff that you used to do, like they're doing, but they're like still in that stage of I'm fine, like, but what would you tell someone who's sitting there like, I don't know if I'm fine or not?
Yeah, that's a good question. I mean, I think it's it's kind of like a trade-off, right? Like, it's maybe you're sort of fine, but it's like at what cost in terms of your emotional and psychological and mental energy. The other thing that comes to mind is like, I wonder if it's worth checking in with the people in your life that you love and trust and kind of getting some feedback for them. That's often something that can really like
honest feedback,
tip people to coming in, making the decision to come into treatment. Is like, they're fine sort of white knuckling it and sort of suffering. But when they really appreciate and understand how things are impacting the people that they care about, that can kind of scales for them a little bit to decide to try something different.
That's a good tip. I appreciate that. That's a good one. Get honest feedback from your support group. And that support group should be people that you trust, not just positive affirmation all the time. Some tough love's always good love. So diving back into PE, like ballpark, how long does it take for some sort of results to be noticed? Like, I know everybody's different, but there is a spectrum. And like, what is like typical, ish time that someone will be able to process one of their traumatic situations?
So it's not a long treatment. It is typically between like 10 and 15 sessions. Actually, like I would say 8 and 15 sessions. And some people, so there's sort of different patterns in terms of when they do like studies of this treatment, they measure PTSD symptoms on a scale. So like, higher numbers is more symptoms, lower is better. And typically what we see is that the number of symptoms or the symptom severity, for most people, it's actually a sort of steady decrease from the very beginning of treatment. That is the most sort of common like trajectory. But for some people, it's sort of like slower, and then it kind of dips down later on in the course of treatment. So it is different for everybody. The other thing I would say is that in PE, there's the first couple sessions are usually like you're kind of gathering information, you're talking about what you're going to do in the treatment and explaining it. And then it's usually in the third session where you start that component of the treatment where you're approaching the trauma memory. So for some people, there's actually a little bit of an increase in symptoms when that begins, when you start talking about that treatment. And it's good to know about that. And it's important to know that that can happen and that that's actually not a bad sign. Because for folks that have been like avoiding thinking about the trauma and avoiding, talking about it and everything, for a while, and they've been somewhat successful in doing that. Like when all of a sudden you start doing something different, all of a sudden you start talking about the trauma, thinking about the trauma, revisiting the memory of the trauma, you are sort of shaking things up a little bit. And so sometimes people do notice that the trauma is like more on their mind. Maybe they're, more dreams and things like that. That we actually think can be like a good sign that they're like engaging in the therapy. They're really giving it, their best shot and kind of diving into the process. And it's temporary. So it's usually just a temporary little sort of flip. And folks that do experience that still benefit a lot from the treatment, like as much as people that don't have that increase. So it's not like a bad sign, but it's just sort of a good thing to sort of know about, that hopefully your provider would like mention that and just give you a heads up so that you don't think like, oh gosh, this is getting worse. Like this whole thing was a bad idea, and like drop out of treatment.
I guess along the same lines, PE is not going to work for everyone. Is there any indicators or personal, like individual characteristics or anything that may key off on this is going to be really beneficial for you, or this may not be beneficial for you? Is there any outliers or anything like that supported by the data?
Not really. That's sort of like such a big, important question that
Right.
a lot of researchers are, trying to better understand that, because yeah, PE is a great treatment, and it's probably the treatment that has the most evidence to support it. But that doesn't mean it's like better than anything else necessarily. There are other really well supported treatments that could be helpful for people too. And there isn't any treatment that is going to work for everybody. But so yeah, like it would be wonderful if we knew like, oh, like you had this trauma, or you have this sort of, set of characteristics, like your best treatment is going to be treatment A or treatment B. We are not really, as a field, we're just really not there yet, but that is, people are doing that kind of work right now, but we're just not at a place right now where we can do that. So at this point, it's really more about like, okay, you kind of learn a little bit about what the treatment involves, and then does that seem like it's a fit for you? Because there are other approaches, like cognitive processing therapy is another effective treatment for PTSD. It's also a trauma-focused treatment, but it's different. Like the way they do the therapy is different. So it could be worth learning a little bit about that and seeing if that seems like that would, fit your style a bit better. But there's not anything else to really go off of, make that call.
If someone's searching out PE therapy, I have veterans and first responders as well as families, because a common thing is secondhand PTSD when dealing with someone
Yes.
With PTSD. So if someone's looking for some sort of PE treatment, where would you suggest they go? I know VA is a good source for veterans,
Yes.
but what about bigger scope? I'll let you talk. I won't talk for you. Sorry.
Oh, I so wish I had a better answer for you, Jonathan, because it's it can be really tough. It can be really tough to find a therapist that does evidence-based treatment. It can be hard to find that and to learn what they do. And VA. I mean, if you're a veteran, definitely VA, because PE and the other treatment I mentioned, cognitive processing therapy, have been like rolled out throughout the VA. So you should have access to those treatments as a veteran through VA. And VA really does provide good quality psychotherapy relative to what is available out in the community, which is just so much more variability. If you're not a veteran, some things you could try doing are looking for a provider through some provider referral lists, but there's lists of providers that you can access through kind of scientific-based professional organizations. So one that comes to mind is ABCP, which is the Association of Behavioral and Cognitive Therapies. They have a find a provider tool. Anxiety Disorders Association of America, I think, also has a find a provider tool. Those are the ones that kind of come to mind. And the other thing is just, when you're reaching out to providers, you should really ask, what's your training? Do you do cognitive behavioral therapy? Would you do exposure therapy? What kinds of treatments do you provide? How long does treatment last? How do I know when treatment's done? those are all good questions to ask a potential therapist before jumping into something.
At the end, we're just going to, in summary, is there anything you would like to talk about or hit on about PE that, stands out to you that maybe we haven't covered?
Well, the only thing that comes to mind is that there's some barriers to implementing PE, but I don't think that's as relevant for folks that are just sort of thinking about getting treatment or not.
Well, this doesn't have to be a be-all episode. There could always be a part 2. So if there's anything that you think of down the road, you can just hit me up and I could do a part 2 and throw in another 5-10 minutes of this for sure. I think with that, we've covered everything on my list. And, if there's nothing else that you want to talk about, we could just wrap this up. And I really appreciate you coming on. I think it was really informative and very good information, as well as it gives like an overview. But
that comes to mind is maybe suggesting that the National Center for PTSD has a really good website with so much really helpful information. And it's not just for veterans, it's really for anybody that's struggling with post-traumatic stress. Good resource to learn about PTSD and learn about different evidence-based treatment options. And different sort of resources and tools. So I'd really encourage people to maybe check that out, the National Center for PTSD.
Awesome. And everything that you referenced, I will throw in the show notes, so it'll be easily accessible to everybody.
Sounds good.
Awesome. With that, we'll wrap it up. Thank you so much, Dr. Mclean.
Yeah, thank you for inviting me. Appreciate it.
And that's it for this episode. I hope you found something informative. Maybe walk away with a different perspective on things or just a different idea on how to better the quality of your life. And until next time, chat soon.